Hello, everybody. Suzanne with Dawning Vision's Hypnosis. Do you realize that the way that mental health therapy is conducted hasn't changed in the last 100 years? It really hasn't. And maybe there's a problem with that particular scenario because there's a lot of patients who find themselves not having their problems resolved. There's a lot of patients who get frustrated because they learn why they have the problem, but they never learn how to get rid of the problem or get rid of it. And there are others who are put on medications, sometimes really toxic medications. And we know they're toxic, especially if they're on these medications for a long period of time. So we need to ask ourselves some pretty serious questions as to why it is that the therapies provided aren't really doing the job. And I'm going to tell you my assessment after having worked in both conventional psychiatry as a non-licensed counselor, supported housing programs, as well as working in a social club for mentally ill adults, 19 and up, what I found to be problematic. The first problem is that not everybody needs a diagnosis. You may, as a therapist, need a diagnosis in order to get reimbursed by the health insurance companies, but the patient doesn't need a diagnosis. They're going through a difficult time and they just need some support and some ideas on how to better address the issue so they can move on with their lives. Secondly, we need to really think about who we're putting on the medication and why. Because not all people need medication, as I said before. And once they're on some of these medications, the antipsychotics, which are used for situations other than psychosis in some cases, or they're put on some antidepressants, it's really hard for them to come off them safely. And that's a problem. But my largest issue is that I have a problem when we tell people that they have something pathologically wrong with them, especially since there's no real science to back this up at all. And I can tell you, after working for over 20 years with hypnotism and neuro-linguistic programming, after learning quite a bit about psychology and psychiatric patients, having worked with them for, 6 years before I got into hypnosis and neuro-linguistic programming, that most of my clients were able to overcome their problems when we got into their subconscious mind, where all of these limiting beliefs and their feelings are. So we can transform them from being, shall we say, dysfunctional, because they certainly weren't adding anything positive to the patient's life, or could we possibly transform them, working in the right area of the mind, the miglia in the hippocampus, so that they were no longer doing those dysfunctional behaviors and got rid of the dysfunctional thoughts that led to those dysfunctional behaviors, and instead gave them life-giving thoughts and behaviors. I can tell you that my clients were thrilled to let go of these so-called diagnoses because their symptoms were no more, because we actually got to the cause of the problem and we understood why they were still exhibiting these behaviors, and it was all released. And they were able to move on to actually enjoying their lives, working into their compelling future, because that's what most of the work is that I do. It's 20% getting rid of the symptoms, and 80% is helping them to move on with their lives. And I do believe that people do have a right to move on with their lives and not to have to live with a mental health diagnosis for the rest of their lives, especially when I have proven, or should I say, my clients have proven over the past 20 plus years that they don't have to have those labels because they don't have the symptoms, some of them going on 19 years. So how about we get a different paradigm, one that allows people to actually heal the cause of the problem and the reasons why they're holding on to it, and help them move on with their lives. Because the majority of your patients absolutely can do this. I don't care if they've had anorexia, bulimia, sex addiction, depression, anxiety, any of these things can be turned around. My clients have proven it. So if you're interested in actually learning how to do this with hypnotism, neuro-linguistic programming, which would be really interesting for you to learn, especially because you have the basis of understanding of mental health and mental illness, I do offer a 2-day VIP program with a 12-month mentorship, so that if you have any questions on how to go forward with a patient, you can just message me and then we'll set up a time to have a video call and I'll tell you what you need to do, and you're going to find it amazing when they actually get through it, because that's what my other trainees have found. I will leave my contact information below in the description box if you'd be interested in learning more about this program. I don't know of any other hypnosis or neuro-linguistic programming training business that is offering mentorships, but I will tell you that that's the way I learned how to do this work effectively. And I want anyone who learns how to do hypnotism neuro-linguistic programming, because you are working the subconscious mind of your patient, to learn how to do this stuff competently so that you're helping them and not causing more distress. That's the last thing we want to do. And it is a mission of mine to actually teach as many of you as possible how to integrate this work into your work. Well, that's all I have for you for now. As always, I thank you for spending your time with me. Till next time. Bye-bye all.